Hey everyone, welcome to week one. So this week we're going to be talking about theory and intervention and how they intertwine. We're also going to be talking about the client and worker relationship, which we've already talked about last semester, but we're going to continue to talk about this semester as well. So to start off, what is theory? Now, your entire social work practice, you will always be thinking, what theory applies to this client? The truth is there's going to be more than one theory that applies to that client. And it's really about what you feel is going to work for that particular client. That is what you apply to them. What I always suggest doing is thinking about what theory has stronger points that apply to your client, as to that's going to be the primary theory that you're going to be working with. So thinking about what is theory and why do we even use it? So theory is a system of ideas intended to explain something, and how we use to define it guides us in our practice to achieve the desired result for the client. So some common theories you'll find yourself gravitating towards are the ones that you feel will help the client, but also shape you as a clinician. So some common theories you may often use are strengths-based theory, solution-focused theory, person and environment theory. Psychodynamic is pretty huge when you've encountered trauma. Also, cognitive theory is pretty big as well. Now, these are just some suggestions. There's a abundance of theories out there, as you all know, but these are the most common that I even see myself working with in the field, and you might find that for yourself as well. So now applying these theories or any theory to your client will dictate what intervention you choose. So as I stated before, you might find yourself beginning in strengths-based theory, but then all of a sudden you ended up in psychodynamic theory. That's not something to be worried about. That's something you're going to gain as you become more confident as a clinician to bounce around to different theories, but yet still be using different intervention techniques. So theory and intervention are also two different things. As clinicians, we can use different interventions from different theories. Now, you may think how, and you may think why, but for example, if I'm applying a strengths-based theory and I can actually intervene using a solution-focused technique at the same time. So as I stated earlier, you can bounce around to different theory, and you can also bounce around to different interventions. You'll often find that a lot of the different theories that you find yourself in are what you believe in as a clinician, and you're going to get stronger at that, and you're going to get stronger at their techniques, stronger at their interventions, and then all of a sudden you're going to find yourself, you started at cognitive theory, now you move to person and environment, you move to ego psychology, you're going to bounce around because that's how you're going to gain strength as a clinician and more confidence. So now most of you won't even realize that you do this, and that's the beauty of social work. We're going to be continuing to talk about this throughout the next coming weeks as well. And so what I really want you to think about this week and take the time to really, really ponder this question. I want you to be able to post this in the client relationship section of the post this week. So I want you to think about what theory you find yourself gravitating toward and why. Is it that you were taught that theory first? Is it that maybe in your internship, that's the only theory that they use currently? Is it that you maybe read about this theory and you find it resonates with you, so that's what you apply to? I want you to really think about that. And there's no right or wrong answer here. So I want you to really think about what theory you feel you're using often, when you're thinking about case studies and things like that. So I want you to write about 2 to 5 sentences on this response. So that I can get a better feel of, what you feel. And I want you to also understand how you feel as well and what theory you find yourself using more. Because as I stated earlier, as clinicians, we are going to use many different theories and many interventions, but there is always that one theory that most of us clinicians always go back to at least begin or in the middle or in the end. So I want you to start to think about now which theory it is that you're gravitating toward and why. So I'll look for those responses in the client relationship post. So you can just post it after you post your questions, then just post that under it. So now moving on to the client-worker relationship. And I feel as though some of you are going to think we've talked about this and we've beaten it to a dead horse, but it's extremely important because without the client-worker relationship, we really have nothing in the social work profession. As much as they put in is where we are as well. So the working relationship will be tested by your client often. You're going to find that the client will put up a lot of defense mechanisms to have you stop pushing them where they don't want to go. They may often blame you as the reason of why they don't feel better. It's that maybe you don't understand where they're coming from, or, you're not a good therapist. They don't feel like they have a good relationship with you. You're the reason that they're still in this rut. It's all your fault. You have to really understand that their defense mechanisms are going to come up pretty strong. A lot of clients that come to therapy don't often have a positive outlet for expression, so you're their only option. So when you start to push them into avenues that they really don't want to talk about, all of a sudden you may see a change in them as to their anger is going to come out, their frustration is going to come out. They're going to be projecting a lot of what they feel in regards to their own emotions onto you, because you're the easy target. You're the person for them who in their eyes is supposed to be there to help them. So for them, they're going to project all that onto you because you won't run away as so many have in the past. So that's something to really keep in mind. You also have to really keep in mind that we really need to meet the client where they're at. And you may think, oh, I've heard this statement, a million times. I know I have to meet them where they're at, but it's extremely important because sometimes I often find, in my practice and talking with even students that I supervise at my current practice, they put so much into the relationship, not understanding that the client themselves is only giving 30% and you as the clinician are giving 100. And, you really need to understand that no matter how much energy you put into a client, no matter how much you want it for them and you want them to succeed, they themselves need to do that. And if they're only putting in, 30%, for example, you're not going to get much movement. So you really need to, in your first few sessions, you're really going to start to understand where they're coming from and kind of gauge where they're at. And to be honest with you, I suggest you actually confront that. I would confront it in obviously a clinical nature. Don't explain, hey, I think you're only giving 30% to this relationship. But, explain that you feel like maybe they're holding back their feelings. You feel as though, you want to help them get to their goals. However, you're not sure if they themselves understand what their goals are. Explaining it to them in a term that they're going to understand is better, going to get you the result that you want, to have them continue to see you as a person they trust and a person that they can really express themselves to. So be open about this and understanding that some clients just aren't ready or they feel change, but we just need to continue to empower them through this process to their fullest potential so we can help the client move through the phases and they can see us as more of a helping agent rather than a hurting agent to them. Now, lastly, Walsh touches on spirituality and practice. Now, this is about your comfort ability as well, to discuss how God plays a role in their life. Now, mostly all of your clients are going to have different religions when they come to you. So what I always say is if they bring it up, I would say that that's fair game to kind of explore that with them. And if they feel like, bringing God or whoever their, whoever their person is that they pray to is, if they feel comfortable to bring it into therapy and talk about it, maybe they pray often about their problems and that's a strength for them because they feel religion for them helps guide them. I say if they don't bring it up, I would say stay far away from it, because if you start to bring it up, they may feel that you're pushing your ideals onto them and they're going to feel like all you care about is your ideals and they're going to pull back extremely right away, especially some clients really aren't religion oriented or they feel as though they have a religion. So the moment we bring up, do you pray or do you feel God has played a role in your life? For some people, that's a really difficult question. And I find that when you pose it, some people get extremely defensive. So as I state, I feel as though if they bring it up, you're allowed to explore it. I feel as if they don't bring it up, it's kind of murky waters as to how they're going to react if you should bring it up. All right, everyone. So that's my overview of week 1. I want to, as I stated earlier, I want to make sure that I see your post that I talked about earlier. So I'm going to look for that in the discussion board. I can't wait to read all of your discussions. So if anyone has any questions this week or they need any clarification on anything, please feel free to let me know. All right, everyone, have a great week 1. All right.